Hello and good evening. It's me again, Caroline. I am your host as always. And well, tonight we have another second live event. And with us tonight, we have another expert and another topic. So, welcome back. I hope you can hear me loud and clear. Dr. Clara, can you hear me as well?
Yes, I do.
Perfect. Thank you so much for confirming that. And well, let me start off with thanking to our ambassadors and partners as always. So you can see them right here on the screen. And as always, I want to thank them for their support for those events, because of course, those events has been brought to you with the help of those ambassadors and partners. So again, huge thanks. And also, well, I would like to introduce our special guest, our expert, as I mentioned. Today with us is Dr. Clara Colomé, and she's the Medical Deputy Director at Eugene Clinic, which is located in beautiful Barcelona. So hello to Barcelona as well. Dr. Clara, how are you today?
Hello, thanks for the introduction, Caroline. I'm fine, thanks. Nice to be here tonight. A pleasure.
Happy to have you. And Dr. Clara will talk about fertility, preservation, egg freezing. So this is a topic that is definitely interesting and very, very important. So as always, she will start with her presentation on that. And later on, it will be time for your questions. So all you need to do is just simply type in those questions in the chat section so that Dr. Clara can answer them for you. And well, I believe that is it from me at this point. Dr. Clara, are you ready to begin?
Ready to go. Thank you, Caroline. So again, as Caroline nicely introduced, we'll first start with the presentation, and please keep your questions for afterwards, and I'll try to solve all of them. We'll discuss today on social fertility preservation or oocyte preservation. Well, I come from Eugene Clinic in Barcelona today, and first, I would like to introduce a bit the situation where we are now. Why is this topic this interesting? Why are we discussing that much about oocyte freezing lately? Well, because several changes have occurred during the second half of the 20th century and the beginning of the 21st century. First of all, women started working outside of home, which was first change, and also many effective contraceptive methods appeared that allowed women for the first time to decide whether they wanted to become mothers or not. Women were empowered to decide whether, when and how they wanted to conceive. This is a very important socio-demographic change, but it confronts with the fact that the best biological age to become a mother should be around 18 to 30 years old. However, during this period of time is where women are developing their professional careers, finding their place in the world, and constructing their personal life. And sometimes this leads to a conflict of interest between social and biology. As you can see in this graph, here we see the mean age at first birth for women all over the world from the 1970s. So you can see in the last 40 years, the mean age for the first birth has been steadily increasing all over the world. Here you see this line is Spain, we're leaders on that. The mean age for the first child here in Spain is almost 32 years old right now. But the mean age in the European countries is 28.7 years old. So as you remember, I told you the ideal age would be between 18 to 30. So we are getting past that already. And what is the problem? Well, the problem is that women, I'm sure most of you are already aware of that, we have an ovarian reserve, a number of eggs, a number of oocytes in our ovaries since our birth, and we use them until they're finished. So that means that with age, we can see a decline in fertility chances. And you can see here, this is your chances of having a child depending on the age. So you can see here after 35, this starts declining faster, and after 40, it just goes down very fast. And on the other hand, we have the risk of miscarriage that also increases with age, because the eggs that remain in our ovaries might have some alterations because they've been there for 35, 40 years old. So we get to a critical point here around 40 years old where your chances of having a miscarriage are higher than the chances of having a child if you get pregnant. So what can we do about that besides the obvious answer, which would be have children earlier on life? Well, this is a very good response for some people, but not all women are willing or capable of conceiving earlier in life because they are studying, they are working, or they haven't had the chance to meet their partner yet. A very good option in those cases would be oocyte vitrification. We will discuss a bit more about that, of course, in detail. How does this work? Well, naturally, every month there's an oocyte, an egg, that is selected from many of them in your ovaries and is ovulated mid-cycle. The idea of fertility preservation, the idea of oocyte vitrification would be to stimulate your ovaries mildly with some medication in order to develop more follicles that would be lost otherwise. So we do this medical treatment for 8-10 days, no more, and we do 2-3 checkups during the procedure with an ultrasound or a blood test to make sure that your ovaries are responding correctly to the treatment. And at a certain point, when we see that the response is correct, then we retrieve the eggs through the vagina with a very simple procedure. Total period of time of this procedure is less than 2 weeks. And how many eggs do we retrieve? This is a very common question that I have. This is a very interesting article published by Goldman in 2017. It looks a bit complicated, but I think it's quite graphic. Here you have the probability of having at least one live birth at home, depending on the number of mature oocytes, which is the good quality oocytes that we have vitrified. So here the blue and red lines here are the ones of patients who are younger than 35, where you can see that with 10 eggs, your chances not of having a pregnancy, but of having a child at home afterward is 80%, which is really high. And on the other hand, we have here this purple line, it's more a line than a curve, which is a patient who's 44 years old. In order to have 50% chances of having a child, she needs to have over 80 vitrified oocyte, which is really a lot. That means that the younger the woman who vitrifies her oocyte is, the fewer oocytes she needs to have at least a child. And that's one of the reasons why after 40 years old, this is not a technique that we usually indicate. Of course, there are always exceptions, but when we balance your chances afterwards with these eggs and the number of procedures you would have to do or the number of eggs that we would need to obtain, then the balance is not good. So how many oocytes again? Well, the live birth rate per vitrified oocyte, so that means the chances of having a child per frozen egg varies between 4.5 to 12%, depending on the series. And well, if we have at least 8 good quality or metaphase 2 oocytes vitrified at 36 years old, your chances of having a child are 62%, which is very good. So that's what we usually advise you to have. Of course, it depends on the age. Again, the younger you are, the fewer oocytes we will need. But usually, the range of oocytes that we advise to vitrify, it starts to be considered good when it's between 9 and 15. Of course, for some women, this will be easier than for others. Many patients do one stimulation cycle and have very good number of oocytes, and that's it. But in some cases, we might advise you to do more than one cycle in order to accumulate oocytes. The advantage of this procedure is that we can do it more than once, and therefore we can accumulate these oocytes. So we can do a double stimulation, which means that we do 2 stimulation cycles, one after the other, and we do 2 stimulations, 2 egg retrievals, and in a month time, we've already done it twice and you have everything. Or we can just do once and a few more months later repeat if you prefer it for logistic reasons. Then inside the lab, the biologists will take a look under the microscope into the follicular fluid that we've aspirated during the oocyte retrieval. And they will check if the oocytes we've obtained are good quality. They are in what we call a metaphase 2 stage, which are the ones that will eventually be capable of being fertilized. And then they will be introduced in different straws and cryopreserved with nitrogen in our nitrogen banks. The quality of these eggs from that moment on doesn't change. And they are still young, which means that if you vitrify at 36, but then you want to use these oocytes when you're 45, the chances this oocyte will give you, of course, will be the same as if you had used them when you were 36, which is the whole point of this procedure. And does the cryopreservation impact the outcome of these oocytes? Is it safe for the oocytes? Will my children afterwards have more problem? No. There's been a lot of controversy on this subject for a few years, but for many years already, we've seen that this is a very safe procedure. That you have here 2 articles, but there are many on this subject. There are many studies on this stating that the fact of having had your oocytes, your eggs preserved for many years does not have an impact on the risk of embryonic malformations or aneuploidies. So I'd like to tell you a bit also about our experience, because sometimes you can see yourself reflected on our profiles. Well, we've started our vitrification program, which is called Time Freeze, in 2011, and we've done over 1,400 treatments already. Over 90% of our patients, our women who vitrify their eggs, are single, which means that most of them haven't had the chance of naturally conceiving, and they want to preserve this option for the future. And I would like to show you as well the results. You can see here the age evolution, the mean age evolution of our patient over the years. So again, in 2011, the mean age of patients who applied for this program was 40 years old, which is a bit old. But as this program has been more explained and doctors, gynecologists, and patients are more aware of the age impact on fertility, the mean age for this procedure has been steadily declining. So nowadays, the mean age of our patients is a bit less than 37 years old. And this is also a very interesting graph, I think. Here you see the red line is the mean age per year in our center. So that's the one I showed you earlier. This is 36.9. And then you have the mean number of oocytes obtained per cycle. So nowadays, and it's logic, since the mean age has been declining, the mean number of oocytes per cycle has also been steadily increasing. So we are around between 9 and 10, as I was telling you before. And most of our patients reach a logical number after just one stimulation cycle, because the mean number of cycles per patient is 1.2. Okay, so that means that most of our patients, after just one cycle, they have enough satisfactory results in order to be relaxed and confident that it will help them have a child in the future. The idea at first is to preserve your fertility, but the goal of all these procedures is to be able to use this oocyte in the future. So let's see the results of the second phase of our program. So 53% of the women who came back to use these oocytes had a partner. So of the 90% that were single at the beginning, now half of them already had a partner, and the other 46% decided not to wait anymore for Prince Charming. And the mean age at transfer is 41 years old. And the mean age at vitrification for this patient was 38, which means that most patients who are already using these oocytes are the one who vitrified later in life. So it makes sense that the older you vitrify your eggs, the faster you will want to use them. Okay, but still, at this age, a year is critical. So using the eggs of when you were 38 years old, at 41, it already gives you a huge advantage compared to all other women at 41 who try to conceive. So this is a bit how our program works. Just again, the conclusion of this discussion today would be that fertility preservation is a need that has appeared related to recent social changes. Life evolves, and so does medicine. That is a safe and efficient technique. There are not important secondary effects related to the treatment. And the vitrification technique by itself doesn't have a negligent impact on the oocytes and the chances and the risk of malformations or complications during pregnancy in the future. Advanced age has a negative impact on oocyte quality and quantity. And again, I think this is the main conclusion of this topic, the thing that we as doctors and you as patient or women in general, we need all women to be aware of the fact that unfortunately, even though life and social situations change, biology, fertility has a deadline for us, unfortunately. And then we need to take this into account when we organize our lives, and we need to take this into account when we think whether we want to, study a second master degree or we want to change jobs or work abroad. We have to think about that and say, okay, I want to do that, I can do that, but then I have to act in consequence and maybe think of other alternatives if I want to become a mother in the future. All women should be informed about this procedure, and this is something that the media, but also general doctors, we have to work with them in order to make them understand that this has to be offered to all women at a certain point in life, so that you know that this is an option that you do have. And that oocyte freezing gives you the freedom to put off the decision to become a mother. But unfortunately, we cannot yet give you a 100% guarantee that you will be able to have a child. So that is also something to take into account. This is like a plus insurance, but it's not a guarantee that it will work, unfortunately. So I try to be concise. I hope everything was clear enough. Thanks for your attention. And now I think we'll pass through the question and answer session and try to solve the doubts you might have regarding this situation or others. Thank you very much.
Perfect. Thank you so much for the presentation and explaining everything to us. And well, yes, it is time for the questions. So are you ready to answer the patient's questions?
Ready to go.
Perfect. Happy to hear that. And we have some questions here. And just let me remind everyone that if you would like to get some advice or just simply ask you a question, then please just type it in the chat section so that Dr. Clara can help you out a bit. And here's the first question. So at what age would you recommend egg freezing?
Well, We usually recommend it, as you could imagine, the sooner the better. It is true that I have women or doctors that say, well, but if I do it too early in life, maybe I haven't, I will want to have children also young. But I would say that if you're around 30, between 30 to 35 years old, and you haven't made up your mind of a, nearby motherhood, that would be the perfect age for you.
Excellent. Thank you so much again for that for question as well as your answer to this. So if I just might add one more. So is there like an age where you wouldn't recommend to freezing your eggs?
Yes, of course. Then afterwards, we have to always take a look into the individual situation. And in medicine, in general, we never say never, or But usually, after 40 years old, we do not recommend this technique. Usually, when you reach 40, then our advice is to try to have a child at that point in life. Of course, in women who have a very good ovarian reserve, we could give it a try, but it's not something that we recommend after 40.
Okay, excellent. Thank you so much again for answering that another question. And here's the next question for you. I am 45 years old and I am in the IVF treatment already for a while. There are very few follicles per cycle and even less eggs. Can the egg be retrieved one by one?
Well, just answering the strict question, can eggs be vitrified one by one? Yes, they can. Is it recommended at 45 years old and already in fertility, in an infertility situation, to vitrify your eggs? No. I mean, the aim of this treatment is to preserve fertility when you do not want to conceive at that point. One of the first questions that I ask my patients when they come for a consult is, do you want to have a child right now or not? If the answer to this question is yes, I want to conceive, then clearly there are other alternatives that would suit you better than to vitrify your eggs. And 45 years old, of course, it's a very delicate situation, and depending on very different situations. But usually, what would give you more chances of having a child at this point would be or an IVF with your own eggs, or most likely, in order to have more chances to use donor eggs rather than to vitrify your eggs at that point. No, we wouldn't do that.
Okay, all right, perfect. Thank you so much for that as well. And there's another question. You have mentioned this in the presentation, but if you could add anything, what is the main reason to freeze eggs, carrier or else? For what reason you would freeze your eggs?
Well, there are several reasons to vitrify eggs. Of course, one would be a professional career. We've done a few studies on this topic in our center, and in fact, when you take a look in the literature and also at our results, you would say around 30% vitrify their eggs because of professional reasons, but main reason actually it is because they haven't found the right partner yet to create a family. I would say 60% are more related to that rather to the professional career. But of course, this would be the two main reasons why women decide to vitrify. And yes, I think it's an incredibly good option. And actually, I advise vitrifying their eggs to all my friends who are getting again close to 30, 35 years old and do not have children or do not want to have children yet.
Excellent. Thank you so much once again for your question as well as your answer to that. There's another question bit about surrogacy. Is it legal in Spain? If so, what is the age limit for intended parents and what is the legal situation regarding intended parents without having to adopt the child born to the surrogate?
Well, sorry, because I won't be able to get you into a lot of detail on this topic because surrogacy is not legal in Spain. Fertility laws in Spain are quite liberal. and advanced considering other European countries, but still surrogacy is a no for us. So we won't be able to help you with that.
Okay, thank you for clarifying that. Of course, there are other countries where it is possible, like Ukraine, Russia.
Yeah.
So definitely we can advise to check those to see what could be done, of course. All right, perfect. Thank you so much. And now let me go to the next question. How much that procedure costs, including cost for storing until use?
Well, it also depends a bit on the medication and the center, of course, where you do it, but it would be less than 2,000 euros for the treatment. And in our facility, we keep them frozen for 4 years with no extra cost, and then you have to pay a maintenance per year, which is less than a coffee a day. But so around 2,000 euros. Then depends on the medication you have to buy.
Okay, perfect. Thank you once again. And next question is right here. So, is there a treatment painful? Any side effects on patients, lose on natural fertility, bleedings, early menopause?
Well, I didn't discuss that on the presentation, so it's a very good question as well as the others. But no, the treatment is not painful. We advise you to do a hormonal treatment, usually through injections, but they're very, very small injections that you inject yourself. It's really simple to do. Most of our patients do it themselves. And well, of course, as any medication, it might have side effects, but they're usually really mild. You might feel, in most cases, like if you had a premenstrual disorder, premenstrual syndrome, where you feel a bit bloated and you might have more vaginal discharge, you might have a bit of migraine or breast tenderness, these kind of things. But usually it's very mild and it disappears after the treatment. Clearly, it doesn't have an impact on natural fertility, because what we do is that every cycle the ovary recruits several follicles, several oocytes. But again, at the end, only one is selected and the other ones are lost. So what we do is we take advantage of the ones that would be lost otherwise. So it doesn't absolutely not have an impact on your natural chances of conceiving, and it shouldn't cause any bleedings. Or, of course, again, if it doesn't affect your natural fertility, it doesn't cause early menopause. The age of your menopause will be determined for other reasons, but not for that, of course not. So you can be reassured about that.
Perfect. Thank you so much once again for clarifying this to us. And well, let me have a look. There's another question right here. If patient age is above 40, then fresh or frozen eggs is better for live birth rate?
Well, if we're talking, usually the only thing is that fresh or frozen eggs is basically have equivalent pregnancy rates. With the techniques that we use nowadays for vitrification, our chances are equivalent, just as good. The only thing is that the older the patient is, the more likely that the oocyte doesn't survive correctly to the thawing process. When we talk about a woman who's under 37 years old, the chances of the oocyte to survive the thawing process is over 90%. After 40, of course, these chances might get lower. So the pregnancy rates at the end, if this oocyte survives the thawing process, are equivalent to a fresh oocyte. But we add this risk to the procedure. That's one of the reasons why, after 40 years old, we do not advise you to vitrify your eggs.
All right, excellent. Thank you so much once again for that. And now let's go to the previous patient. Okay, there was a question. Okay, follow-up question regarding 45.
Yeah.
The reason I ask about the vitrification is that due to this corona times, my partner is in Italy and I am in Greece. I am into the IVF treatment already, and my partner's sperm is not available anymore, used already in the previous cycle.
Well, it's true that the coronavirus pandemic has had an impact on everyone, of course, but especially in our fertility patients, this is really complicated to handle for all of us. Clearly, yeah, of course, ideally, I would advise you to, well, again, whether using donor eggs or doing an IVF right now. Clearly, every month counts on your case. So if you cannot create the embryos right now, yeah, sure, let's say an alternative option. Desperate times require desperate measures. So this would be it, I think. And in your case, well, it could be an option. We do not usually do it we never do it actually at 45, vitrifying your eggs in the context of fertility preservation. But I'm guessing that this is an exception, and it's not for fertility preservation. It's for an IVF that you will do once it is possible for you and your partner to get together, hopefully soon. The situation with the coronavirus epidemic is improving little by little in Europe, and hopefully you will have a chance to proceed with your treatment soon. But yeah, it's something that we could take a look at, but it's not really a procedure I still would recommend, even though considering the situation.
Okay, excellent. Thank you so much once again for answering to this question. And let me have a look. There is another question coming up right here. What could be the reason the body stops reacting to the hormonal treatment during the egg collection, and instead of the follicles to grow, they are becoming smaller, even those that were growing properly?
Well, especially when age advances and ovarian reserve declines, ovaries might not work as we expect them to. So, you know, this is usually the ovary is a machine that works like, I don't know if you say that in English, but like a Swiss clock, means it's very regular. But as age advances and ovarian quality declines, again, ovaries might react unexpectedly. So sometimes it looks like there are a few follicles that are starting to grow, but eventually they don't react correctly to the medication because the quality of that egg is not good enough. If your eggs, your ovarian reserve, the amount and the quality of those eggs is good, they will respond correctly to the medication. If they don't, this means that usually this is because your oocytes were not good enough to begin with, most of them. It is true that then there might be variation on the medical protocol that could be applied. We would have to take a look into more detail to the case in particular, but usually it's linked to the quality of the oocytes.
Okay, perfect. Thank you once again for that. Okay, so is it any way to verify the quality of the oocytes once they are vitrified? How much does that cost?
No, what we do is we do the oocyte retrieval, and then inside the lab, before vitrifying, the biologist takes a look at the oocyte and see if it is in metaphase 2 stage of development, which is the ones that are good quality enough to be used. Once they have been vitrified, we cannot verify their quality or their genetic material. Eventually, if you use them in the future, we could do a PGT diagnosis on the embryos once they are created, if there's an indication for that. But no, there are no specific tests to verify the quality of the egg once it's vitrified.
Okay, thank you once again for answering this question. We have more questions coming up here. And the next one is, good evening. Does the egg quality differs depending on the protocol and medication types? Example, short or long protocol? Thank you.
Well, as some of you might already be aware, there are different medical protocols that are used for an ovarian stimulation. We can use agonist for the blocking. We can use antagonist for the blocking. I don't want to be too technical about that, but there might be slight differences using one protocol or the other, depending on the patient. But it is true that scientific evidence doesn't show one protocol is statistically better than the other. So for one patient in particular, yes, maybe a short might work better than a long or the other way around. But in general, no, they are. There's not a better or worse protocol. Usually, when we do a vitrification protocol, we use a short antagonist protocol because it allows us to trigger the ovulation with GnRH agonist, which allows us to control better the risk of hyperstimulation, and it allows us to go back to normal faster and minimize the discomfort that might be linked to the procedure. I don't know, maybe that was technical, but it was a quite technical question.
Excellent. Thank you so much for that question in detail, as well as your answer to it. And there is another question, a very important one, as everyone is wondering that. I'm from France, where egg freezing is not allowed. Are you open during this quarantine? Can patients travel to your clinic? All the clinics offer online consultation, but won't start treatment until September.
Well, this is a very good question. Well, yes, it is true that there are different legislations in Europe regarding oocyte freezing, and in some countries such as France, it's only allowed when there's a medical indication for it. Here in Spain, of course, social vitrification is allowed, as you can imagine. And yes, we had to stop our treatments following the advice of the Spanish government and the European and Spanish fertility societies, but we've restarted our treatments already for a couple of weeks now, because it is true that we have to make sure, and safety is the most important thing, but it is also true that deferring fertility treatment or a vitrification treatment might have a real and important impact on the patient's chance to conceive in the future. I'm pretty sure you've read about that, but the coronavirus pandemic, the infection with the coronavirus virus has not proven to affect the chances of pregnancy. It doesn't have an impact on the fact of being pregnant doesn't impact the severity of the disease if you have it. And up until now, of course, it's a very recent disease. We've only known coronavirus for 4 months, even though it looks like a lifetime. We do not know everything about it, but up until now, studies do not show an increased risk of malformations or other complications during pregnancy related to the coronavirus infection. That's the reason why a spontaneous pregnancy has not been contraindicated anywhere. I'm not sure if you remember, but during the Brazil Olympics, there was the Zika infection where it showed that it caused malformation on fetuses. And in some regions of the world, spontaneous pregnancy was contraindicated. This is not the case now. It's a very severe disease, but but lucky for us, doesn't impact the pregnancy that much. So yes, we are, to sum up, yes, we are doing treatments right now. And of course, basically the most important problem now that our patients face is how to reach the clinic. But in our facility in particular, we are giving you all the documentation that might be required, because traveling for tourism is one thing, but going for a medical treatment is another. So if you want to come to the clinic, if you were interested in starting a treatment with us, of course, you can contact us and we would explain to you how exactly we can help you with the documents that you will need to come to Barcelona. But yeah, sure, we still work. And we've applied all security and safety protocols in order to minimize the risk for you to get the disease and for us clinicians, of course. So we will have to change a bit the way we work, but we will still help you get pregnant or preserve your fertility in this case.
Excellent. That sounds really reassuring. So thank you a lot for
It is.
that. Yes, we are definitely all waiting for that for those options to be able to come to the clinics. Yeah, so it's definitely good that it's possible, right? Okay,
Yes.
perfect. Thank you so much. And the next question is right here. Can the vitrification take place using a natural cycle and not doing a hormonal treatment?
Well, yes, technically it can be done. The thing is that the aim of this procedure is to obtain, if you remember my presentation, a very good number of oocytes. If we do a natural cycle, that means that naturally you will develop just one oocyte on your ovaries. So it wouldn't be ideal. We do natural cycles when we use IVF and we expect a low response, meaning that if we know we won't get more than one or two oocytes, well, we can avoid the medication, the hormonal treatment. But vitrification is a different concept. The objective is to obtain many oocytes, as many as your ovaries can give us. So it is possible, but it's not usually what we recommend.
Okay, understood. Thank you so much once again for that. And for now, it looks like we have the last question. However, I want to encourage you, if you have any left, go ahead and type it in. And the next question is, during the protocols, does the lifestyle has an impact on the equality? Drinking wine, intercourse during this process, working on your laptop and keeping the laptop on the lap instead of desks, etc.
This is also a very interesting question. Yes, lifestyle has an impact on almost everything, has a clear impact on egg quality, not just during the protocol, but before that. So the first thing I advise my patients is, if they do, I advise them to quit smoking. This is the most important factor. If you're overweight, I would advise you to lose some weight, because obesity might have an impact on the egg quality as well. And of course, yes, alcohol drinking, alcohol intake might have an impact on the quality of the oocytes, as well as basically, I would advise you to carry a healthy lifestyle always, of course, as a doctor for your own health, but especially during the stimulation procedure, I would advise you not to drink alcohol during this procedure. And intercourse during this process, well, yes, it is possible. However, we know that we are doing this procedure in order to not get pregnant at that time. And when we're stimulating your ovaries, your chances of getting pregnant increase, and we would risk a multiple pregnancy. So my advice is, you can continue to have sexual intercourse during the first days of the stimulation, but of course, using contraception, basically condoms. And we only advise you to avoid sexual intercourse for a few days around the date of the oocyte retrieval, because then it would increase your chances of vaginal bleeding, for example, which is very unlikely, but if you have sexual intercourse, you can increase that risk. And then working on your laptop and keeping it on the lap. Well, this is a very, very specific question. Well, of course, I guess you mean because of the radiation and heat and everything. Well, of course, clearly in all situations, it's better to keep your laptop on the desk, but I honestly do not think this has a direct impact if you do it, just once every now and then, on the quality of the eggs. If you spend 10 hours a day with your laptop on your own lap, then, well, of course, yes, I would advise you to avoid it.
Perfect. Thank you once again for that question as well as the answer. And there are more questions here. So let's have a look. This is a longer one. Okay, so let's have a look. What is the
Okay.
data you know of that gives statistics on using embryos that were of lesser quality? I have been through 10 IVF cycles with my own eggs as well as with donor eggs, which either resulted in miscarriage or no pregnancy, had many embryos thrown away because I was told they weren't good enough, and just to keep repeating the cycles.
Well, this is a very complicated case. Sorry for you. You've been through all these. I'm sure it's been tough, and I'm sure you're tired. But you're, perseverating in order to have a child, which is something that I admire of our infertile patients. The strength you have to keep going. So stay tough there. But 10 IVFs is a lot. Of course, I do not have the details of everything, but regarding the quality of embryos in particular that you were telling me, well, we have different systems of classifying the embryos regarding their morphology, basically. But the morphology of the embryos, because there are some, minimal requirements that an embryo has to have in order to result in a pregnancy. And it depends on whether it's a day 2 or day 3 embryo, or if it is a blastocyst, a day 5 embryo. But the morphologic quality of the embryo doesn't have a direct impact on your pregnancy rates. It has some correlation, yes, but it's not the most important thing. For example, I always explain this to my patients. When we take a look at 2 different embryos, morphologically, they might have day 3 and day 5, okay? They might have the same aspect, meaning they might be, 2 blastocysts, 4 AA, which is just a good quality of embryo. But when we take a look at them under the microscope, the biologist is incapable of telling me the age of this embryo, meaning the age of the oocyte. And this is the most important factor. So it's not the same thing, 4 AA blastocyst in a 43-year-old woman, the 4 AA blastocyst in a 32-year-old donor. And clearly your chances are completely different. In one case, you would have very, very small chances of having a child, and with the other one, they are over 50%, so or 60%. So clearly, the embryo quality is something that has to be taken into account, but it's not definitive for us to decide whether we are going to have a child or not. So basically, this is something that would have to be discussed. There are some specific cases, maybe, I don't know, Caroline can translate the questions to us afterwards, and we can have a one-to-one talk about these situations. But yes, you were telling me, you see, some were with donor who were 25 and had twins. Again, yes, age is a very important factor. So maybe, well, if the embryos, it's very difficult for me to, doubt the indications for a particular embryo to be transferred or not in another facility without having all the details. But usually with donor eggs, of course, we are more strict with the quality, but the chances of an embryo of a donor working, even though the aspect is not as perfect as we would expect, are still surprisingly high.
Okay, perfect. Thank you so much. And I want to remind everyone that if you would like to get in touch with Dr. Clara and get some more details, of course, she will need definitely more details. You need to just click on the link I have just sent, and there is an option to ask your questions. It will be forwarded to the team, and I'm sure they all will be able to get back to you and help you out as well a little bit more. Perfect. Thank you so much. There is another question right here. How many eggs is the average to obtain in one cycle? What if I go through the medication and only deliver a few eggs?
Well, thanks for the question. The mean number of eggs that we obtain in one cycle, now Fertility, I showed you the slides, it was around 9 good quality, 9 metaphase 2 oocytes. And this is enough or not, depending on your age and your expectations. Also, I didn't tell you that, but of course, it's not the same thing if you're planning on having a large family with 4 children than if you're just planning on having 1. Clearly, you will need more eggs for the first lifestyle choice than for the second one. But the mean number is around 9, between 7 to 9 mature eggs. If you go through the medication and only deliver a few eggs, well, there are different options. We could do what we call a double stimulation, which means we do the egg retrieval, and 2 days later, we start again the stimulation, and around 10 to 12 days after that, we repeat the egg retrieval to accumulate more oocytes. Usually, when we have a low number of oocytes, we will advise you. If we know beforehand that your age is, let's say, advanced for the procedure, or your ovarian reserve is lower than expected for your age, already from the beginning, probably we will talk to you about that, and we will offer you this option from the beginning. But we can also decide it afterwards, depending on how the cycle evolves, and decide last minute whether we want to repeat it or not. And we can do it 2 in a row, or we can just, some patients for logistic organization reasons prefer to just skip a couple of months and then come back, and we can also do that.
Okay, perfect. Thank you once again for answering this question. And there are a few left, so let's get ahead with it. What is your opinion on the success of using a young 23-year-old donor with a 42-year-old sperm? I've been told the bigger the age gap, the potential for problems with any children.
Well, men, let's say, they are luckier than us on this evolution subject. We can carry children, but they are fertile longer. So age doesn't have that much of an impact on the quality of the sperm. It does have an impact, especially on the quantity and the mobility of the spermatozoa found on a sperm sample. And some studies state that the risk of some genetic diseases such as autism, some psychiatric disorders, or some other bone malformations might be increased in older patients' sperm. But this is something that we see, well, we don't really see that much, but this is something that would be expected in even older men over 50 or 60 years old. In fact, our group published a study a couple of years ago comparing our pregnancy rates in oocyte donation cycle depending on the partner's sperm, on the partner's age, if his sperm was used, and pregnancy rates were exactly the same, no matter the age of the partner. So again, well, age is an important factor for everyone, but not depending on the difference of age between the donor and the man, but rather depending on how old the man is. And at 42, for a man, he would still be considered young. We are talking about this type of problems that are starting to increase very slowly after 50, 60 years old.
Okay, perfect. Thank you so much. And next question is right here. What could be the reasons the eggs of the donor would not implant?
Well, this is a very interesting reason that we could discuss about for maybe hours, but many reasons. There are different elements when we talk about the implantation equation. There's the oocyte, then the embryo, which is created from the oocyte, but also from the sperm, which is something that we do not have to forget. So there could be a problem on the oocyte, but this is unlikely when you're discussing donor eggs. There could be a problem with the sperm. For example, sperm fragmentation that is altered even though the quality of sperm looks more or less normal. Then there can be problems with the development of the embryos. And then there can be problems in the endometrium, adhesions, fibroids, and other alterations in the uterine cavity and in the endometrium itself. And then, of course, other general diseases or other more generic syndromes such as hypothyroidism, such as bloating problems, thrombosis, thrombophilia, and other disorders that could affect the implantation rate. Implantation is one of the most interesting but more complex aspects of fertility. Once we leave the embryo inside the endometrium, we do not really are 100% sure of what happens there. It's like they have to discuss one with the other, the endometrium and the embryo, and reach an agreement in order to understand each other and implant. And why this doesn't always happen, even though the embryo has the best quality and the aspect is the endometrium is excellent. This is one of the aspects that are being more thoroughly studied right now, where more scientific studies, where more efforts are put in order to be able to clearly answer that question. Unfortunately, we cannot yet.
Okay, perfect. So thank you so much for that question. As you mentioned, we could do another webinar on that, right?
Yes.
So huge thanks. There are 2 questions left, so we will be finishing. However, last final call for those questions. If you have any left, go ahead and type them in. And the question is, can the triggers before the egg collection be used not 36 hours in advance, but 12?
Well, not really. Usually, the time span between the triggering, the medical triggering, and the retrieving of the oocyte is, if 36 hours. It can be done in certain cases, maybe 34, 35, even we could get to 38, but 12, no, unless you're already ovulating, which that changes the equation. But the triggering for the ovulation, the medical trigger, if we do it 12 hours in advance, your ovaries won't have released the oocytes yet when we go for the egg retrieval. So I wouldn't recommend to do that. The only reason I can think of doing an oocyte retrieval with 12 hours would be that you're already ovulation maybe, and we're trying to recover some of the eggs before they are being lost.
Perfect. Thank you so much once again for that. And it seems that this is our last question for today. So let me go ahead with it. Which day is best, D3 or D5 for embryo transfer?
Well, this is a very interesting question as well. It opens again another Pandora box for for embryos. I would say the easy question, and probably the one that you hear most, would be day 5. I would say it depends. It depends on the case. Clearly, if all conditions are there, if we have a very good number of oocytes and a good number of embryos, allowing the embryo to develop up until day 5 or blastocyst stage gives us more information about the embryo. And it tells us that at least it managed to reach day 5. So that's what we usually do everywhere as a standard procedure, for example, for donor eggs, because it allows us basically to select better the best embryo. And it basically allows us to minimize something that we gynecologists don't like that much, which is multiple pregnancies. If we go for day 5, we can select better and easier the best embryo. And therefore, we are more strict on the number of embryos that we allow our patients to transfer. For example, in our facility, when we use donor eggs, with day 5 transfer, we always transfer just 1 embryo. Day 3, however, is still a very good alternative in certain cases. We have very good chances on day 3, for example. 2 embryos on day 3 give us the same pregnancy rates as 1 day 5 embryo. But that's again the reason why we prefer 1 day 5 to minimize twins. When do I advise to use day 3 embryos? Well, basically in patients who are using their own eggs and do not have that many embryos and are not intended for a PGT study, when we have 1 or 2 embryos on day 3, it's been so hard for us to get there. Your stimulation procedure, the egg retrieval, waiting for the embryos to develop, then risking not having any just for 2 more days in the lab. Well, I prefer, if we do not have doubts about the characteristics of the embryos, and of course they look quite okay, then I would advise you to transfer on day 3, because we know they got there. And we know we have 2, for example, at that point, but we do not know if they will get to day 5. And this might be because the embryo was not destined to develop, but it might just be because, the lab is not the best environment for an embryo. The best environment for an embryo is a uterus. So it's a tricky question. I hope I help you with my answer, and we could discuss it, of course, individually with more detail.
Okay, perfect. Thank you so much. And actually, there is one more question right here. So, can there be few egg collections at the same cycle?
Not really sure I completely understand the question, but in the same menstrual cycle, we can do two egg collections when we do a double stimulation. Yes, you have your period, then we stimulate, then we retrieve the oocyte, and then we stimulate again. So within a month time, we can do two egg collections. I hope this was the answer you were looking for.
Okay, perfect. Thank you so much. It looked like that was our last question. So thank you so much, Dr. Clara, for joining our initiative, for joining us tonight, for your presentation. Very interesting, lots of useful information indeed, and for your expertise, and of course, helping us with the questions as well. And as
My
you can
pleasure.
see, there are patients that already would like to thank you.
Thank you for your attention. It was a pleasure for me.
We are happy to hear that as well. And well, is there anything else you would like to add?
I would like to make sure that you keep in mind again that age is an important factor, but hope the good thing is that now we have tools to decide when and how we want to become mothers. So this is a power that we have now, and we have to use it carefully. So
Okay, perfect. Thank you once again. And well, I would like to thank you for joining our initiative, as well as I mean the patients, of course, as well as being here every single day. As you know, we are having lots of those events twice a day from Monday to Friday, and we are going to continue with those. So again, huge thanks for that you are joining, and I hope that you are receiving lots of answers, and well, hopefully you all will be able to start the treatments very soon as well. Fingers crossed. Okay. And also, please let me remind everyone that this has been recorded, so you will still have a chance to watch this again within the next few days. You will find it on our website, myivfanswers.com, and I can only encourage you to to follow us on Facebook or Instagram or YouTube channel. You can subscribe to YouTube channel, and that way you will be updated when new video is uploaded. So very useful. And well, have a lovely evening, everyone. Dr. Clara, again, thank you so much, and you also
thank you
have a
all.
lovely evening. And
You too.
well, good night.
Good evening.
Bye.
Bye.